But remember this, we're dealing in politics. We're dealing with a thing called November 3rd of this year. Do you know what November 3rd represents, right? You know better than anybody in the room. November 3rd of this year, it's called the presidential election. No matter what I do, no matter where we go, no matter how well we do, no matter what, they'll say Trump did a terrible job, terrible, because that's their soundbite. That's the political soundbite.
I think the only thing that matters is what, at the end of the day, what people are saying about him. He watches people. He watches the news. You've seen him on Twitter. I mean, we have been in meetings where we were supposed to be talking about the virus and either travel restrictions or how we were going to evacuate people off of cruise ships, which was a big issue at the very beginning of this pandemic, and what we're going to do with them. And he wanted to talk for 45 minutes on how upset he was with some news anchor at his preferred news network and who was going to take care of that problem. We have actual items on this agenda that we really need to discuss, and time matters right now. But instead, we're going to go resolve your concern about whatever some news anchor said off the cuff that upset you. That is who President Trump is. That's what he cares about. And that is a factual story, by the way. Yeah. 45 minutes of going off on Tucker Carlson about how he treated Kellyanne Conway. And Hope, are you going to call him? Who's going to call him? I mean, seriously, this went on for 45 minutes.
I think we did a great job with coronavirus, except in public relations.
You know, for the past 5 months, it's been the virus is totally under control. And the cases have been going up and the deaths have been going up.
Look.
But you've been saying it's under control.
Nobody knew what this thing was all about. This has never happened before. Nobody knew the extent. Nobody knew how contagious it was.
But the question is, Mr. President,
maybe China knew.
By June, we knew.
Tonight, new reporting from the Washington Post's Bob Woodward says that President Trump was bluntly warned in January about the threat of coronavirus, but chose to downplay the danger in public.
Pottinger said his contacts in China told him this is going to be like the 1918 Spanish flu pandemic that killed 675,000 people in this country.
January 31st, the China travel ban goes into effect. Now, the president over these last few months has said over and over again that it was his idea to ban travel from China and that no one agreed with him. He says almost everybody was just absolutely against it. It wasn't the president up against the world, but that his advisors actually said, you should do this. And he said, okay. So it's different than what apparently the president has been telling of this story.
Not apparently. It is very different. It's not that President Trump banned travel, people coming from China to the United States. He restricted it, and as we now know, there were some problems, and lots of people from China, instead of coming to the United States, went to Europe and then came into John F. Kennedy Airport in New York, and that's why there was such a firestorm of virus in New York City.
You just breathe the air, and that's how it's passed. It's also more deadly than your strenuous flus. This is deadly stuff.
We saw in this pandemic the countries that got the diagnostic capacity going and actually did think about travel, unlike the United States. They had testing and quarantine capabilities that meant that the numbers, say in a country like South Korea, never got, to anywhere near what they did in the United States.
Germany, France, and the UK locked down within days, learning their lessons from Italy, which took 6 days to lock down the entire country. The US, however, still hasn't declared a national lockdown more than 45 days later. Without good data from testing, US states were essentially flying blind throughout February and early March.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
As life went on largely as normal, the virus was spreading throughout the US.
We're in very good shape. People think that goes away in April.
And as I've said before, I take the position that more tests will actually lead to less cases, particularly if it fully engages public health action.
when you do testing to that extent, you're going to find more people. You're going to find more cases. So I said to my people, slow the testing down, please.
When can you commit, by what date, that every American will have access to the same day testing that you get here in the White House?
Some people have to wait longer than we'd like them to.
It's a big problem. When do you think?
And like many others,
every American.
What I understand you do about that.
But when do you think we'll have it for everyone?
I think that you will have that relatively soon. I mean, look, this is our testing, I believe. This is the testing, yeah.
Yeah, we do more tests.
No, wait a minute. Well, don't we get credit for that? When I took over, we didn't even have a test. Now, in all fairness,
why would you have a test?
There was no test.
The virus
for
didn't
this.
exist.
Why has testing gotten so messed up in this country?
Well, the ideal would have been to have a CDC website that would prioritize who gets tested. Asking states to pull something like that together isn't going to work that well. And the reimbursement's all at the federal level, whereas a lot of communities either don't have access or they get these delayed results.
What are the delayed results? I mean, were they useful?
No, they're useful so you can write an apology note to the people that you've been exposed to over that time period. You can do 24 hours, particularly, if you use the swab approach we talked about, or if you have the drive-in testing where you get the sample to the machine very quickly.
What happened when you talk to the White House people in the administration about testing? Are they listening to you?
I don't think criticizing them will make them more open-minded to my input.
There are those that say, you can test too much. You do know that.
Who says that?
Oh, just read the manuals, read the books.
Manuals?
Read the
What
books.
manuals?
Read the books.
What books?
What testing does.
I'm sorry.
Wait a minute.
Who
John.
said?
Let me.
And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job.
Well, I think, Bob, really, to be honest with you,
Sure, I want you to.
I wanted to always play it down. I still like playing it down.
The CDC says if everybody wore a mask for 4 to 6 weeks, we could get this under control. Do you regret not wearing a mask in public from the start? And will you consider a national mandate that people need to wear masks?
I don't agree with the statement that if everybody wear a mask, everything disappears. Masks cause problems too.
I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will. So I do want to keep asking the American public to take the responsibility, particularly the 18 to 25-year-olds, where we're seeing the outbreak in America continue to go like this, because we haven't got the acceptance, the personal responsibility that we need for all Americans to embrace this face mask.
Well, the CDC's largely been written out of the picture because you have people at the White House who aren't epidemiologists, saying what a great job they've done.
The criticism of you that is most prominent is about the communication. It's the public health experts saying that it needs to be based in reality. And they're saying that the wishful thinking and the salesmanship is just not suitable at a time when a pandemic has killed 145,000 Americans.
When you're in a time of stress, and we are certainly in a difficult period, globally, the whole planet is in that situation, people do gravitate towards and look for candor, honesty, and an articulate description of where we are. They want to know the truth.
He's got a very good approval rating, and I like that. It's good, because remember, he's working for this administration. They're highly thought of, but nobody likes me. It can only be my personality, that's all.
Inappropriately and intensively politicized, that it's almost as if when I give a message of public health, that somehow I'm doing something directly against you, deliberately to hurt you.
Why on earth would your administration be involved in a campaign at this point to discredit Dr. Fauci, who is the nation's top infectious disease expert?
Well,
Dr. Fawcett, it shows him as a leaker and an alarmist.
Oh, I don't know that he's a leaker.
Why would
he's
you
a
do
little
that?
bit of an alarmist. That's okay.
My job as a scientist, a physician, a public health official, is to protect the health and the welfare, not only of the American people, but of the entire world, because we live in a global community. But now to get death threats, to get my family harassed, my wife and my 3 children, I mean, that to me is absolutely preposterous. And there are some people that actually stoke that, encourage that.
So supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me. So we'll see. But the whole concept of the light, the way it kills it in 1 minute, that's pretty powerful. I would like you to speak to the medical doctors to see if there's any way that you can apply light and heat to cure. You know, if you could. And maybe you can, maybe you can't. Again, I say maybe you can, maybe you can't. I'm not a doctor. But I'm like a person that has a good, you know what.
But sir, you're the president.
Deborah, have you ever heard of that? The heat and the light relative to certain viruses, yes, but relative to this virus?
Not as a treatment. I mean, certainly fever is a good thing when you have a fever. It helps your body respond. But not as, I've not seen heat or light.
I think it's a great thing to look at. I mean, you know. Okay.
Respectfully, sir, you're the president, and people tuning into these briefings, they want to get information and guidance and want to know what to do. They're not looking for rumors.
I'm the president, and you're fake news.
Really, I would challenge the media one day to look at somebody they don't like and try to assume the best of their comments. Was it off the cuff? Maybe, doesn't matter. Was it sarcasm? Maybe, maybe not, doesn't matter. How can any adult seriously believe that he was saying, hey, people should inject Clorox into their body? I mean, I get wanting to believe that because you have a pre-existing condition to believe the worst about everything that comes out of Trump's mouth.
He wasn't suggesting that people drink bleach, but also these companies and scientists that are working on using UV light as a disinfectant for like an airplane, for example. And if that is a development that could actually work, that would be a good thing, not just in regards to coronavirus, but for a whole host of things.
Remember? Am I just remembering that?
The thing that's strange, though, is...
And we have stockpiled 29 million pills of the hydroxychloroquine. I've seen things that I sort of like. So what do I know? I'm not a doctor, but I have common sense.
Why not just let the science speak for itself?
It's incredible what it's done for malaria. It's incredible what it's done for lupus. We bought massive amounts of it, 29 million doses of it. But we don't have time to go and say, gee, let's take a couple of years and test it out. And let's go and test with the test tubes and the laboratories. We don't have time. I'd love to do that. But we have people dying today. As we speak, there are people dying. And we've given it to drugstores. We're sending it all over. FEMA's doing it. We're doing it through different channels, many different channels. We have it coming from all of the labs. We're actually now doing it here because in case it does work, we want to have it.
Angela Merkel, the Chancellor, has communicated clearly and calmly throughout the crisis. She has imposed ever stricter social distancing measures on the population, but done so in a measured way, coordinating closely with the leaders of Germany's 16 regions.
Was wir erreicht haben, das ist ein Zwischenerfolg, nicht mehr und nicht weniger.
But she herself stresses that there is no room for complacency.
You know, the last time I was with you was the day before your Tulsa rally in the Oval. And, you know, you were saying big, huge crowd, it was indoors.
By the way,
these people, they listen to you.
Excuse me. First of all, we had 12,000 people, not 6,000. But you couldn't even get in. It was like an armed camp.
Why would you have wanted that?
It was the highest rating in the history of Fox Television. Excuse me, wait. And Tulsa, well, because that area was a very good area at the time. It was an area that was pretty much over. after, a month later, it started going up.
No, I've covered you for a long time. I've gone to your rallies. I've talked to your people. They love you. They listen to you. They listen to every word you say. They hang on your every word. They don't listen to me or the media or Fauci. They think we're fake news. They want to get their advice from you. And so when they hear you say everything's under control, don't worry about wearing masks,
It's
giving them a false sense of security.
Now, I think it's under control. I'll tell you what.
How? 1,000 Americans are dying a day.
They are dying. That's true. And it is what it is.
People who have been convinced that COVID was overblown have sometimes paid a steep price.
Around this time last month, Jupiter rideshare driver Brian Hitchens was a self-proclaimed COVID-19 skeptic.
I thought it was maybe the government was trying something and it was kind of like they threw it out there to kind of distract us.
Fast forward to this week, and Hitchens has a whole new outlook from his hospital bed.
This is a real virus that you've got to take serious. My wife's on the ventilator. She's been like that for 3 weeks.
Trump rally, Ohio's lieutenant governor had the nerve to suggest Trump fans wear masks.
But if somebody tells you to take it off, you can at least say that you're trying to save the country by wearing one of President Donald Trump's masks, all right? All right.
Well, right here, the United States is lowest in numerous categories. We're lower than the world.
Lower than the world. The figure I look at is death. And death is going up now.
Okay,
and it's 1,000 a day.
Here's case death.
Oh, you're doing death as a proportion of cases. I'm talking about death as a proportion of population. That's where the US is really bad. Much worse than South Korea, Germany, etc.
You can't do that. You have
Why
to go.
can't I do that?
You have to go.
Look at South Korea, for example. 51 million population, 300 deaths. It's like, it's crazy
you don't
compared to
know that.
I do. It's on
You
the.
don't know
it's-
that.
You think they're faking their statistics? South Korea?
Look, here's
Germany, low,
here's
9,000.
Here's one right here. United States. You take
Anyway.
the number of cases.
Okay.
Now look, we're last. Meaning we're first.
Last, I don't know
we
what
had
we're
the
first
best.
in.
Is it fantastic?
1,000 Americans are dying a day.
By the time of their final interviews in August, Mr. Trump had become the leader of the one nation suffering the most from the virus. The president came to this conclusion.
Nothing more could have been done. Nothing more could have been done.
I mean, it almost took my breath away that there was such certainty.
And those people that really understand it, they said it's incredible the job that we've done. And again, I bring it up.
Who says that?
The ban.
The president is the wrong man for the job.
You're known as the reporter who doesn't put his thumb on the scale.
It's a conclusion based on evidence, overwhelming evidence.
Woodward's new book, Rage, is his latest work in a 50-year career investigating American presidents.
The title Rage comes from him. He said he brings out rage in people.
You told the president that it was, in your words, a tough book. What did he do?
An hour and a half later, he tweeted out that the Bob Woodward book is going to be fake. The virus is set, because it's in real people's lives, you know, all those tens of millions of people who don't have jobs, who don't have that income. Listen, I mean, you and I...
Nothing more could have been done. Nothing more could have been done.
You write in the book that the president's handling of the virus reflects his instincts, habits, and style. What are those?
Denial, making up his own facts. Well,
I acted early. Acted early.
This will be the history that we start the first draft of, and it will continue. And
So you think the virus totally supersedes the economy?
oh, sure, but they're related, as you know.
A little bit, yeah.
Oh, little bit. I mean,
more than a little bit, but
in the presidency, there's always dynamite behind the door. The real dynamite, it's President Trump.
Do you expect the vaccine to be ready before the election by late October, Halloween time?
It could be. It will be right there. I mean, it's right in that vicinity, either before or just shortly after, because they're petrified that the vaccine comes in, before the election.
We're ready to distribute immediately.
It's going to take us probably in the order of 9 months, 6 to 9 months.
And any suggestion that, a politician, helped create the vaccine or it's faster because of a politician is a very dangerous thing. We saw with the completely bungled plasma statements that, when you start pressuring people to say optimistic things, they go completely off the rails. If there's not a supplemental bill at some point, I do think there'll be an opportunity to have that money come forward. It's literally the billions you have to spend to save trillions. So, it'll be the highest impact part of whatever allocation gets made.
It is going to disappear. It's going to disappear. I still say it would go away without the vaccine, George, but it's going to go away a lot faster with it. It would go away without the vaccine? Sure, over a period of time. Sure, with time it goes away. And many deaths. And you'll develop herd, like a herd mentality. It's going to be herd developed, and that's